Hello, welcome to May 2022 Grand Rounds webinar. My name is Jamie Gillespie. I am excited to announce my new role as your clinical nurse leader. This seminar is for nurses who expressed interest in pursuing a graduate level nursing degree. Earning a master's of nursing taught me that nursing is both an art and a science. This knowledge greatly enhanced my clinical judgment and decision-making skills. Today I will discuss with you what is the art and science of nursing, and I will share a particularly impactful clinical experience for me as an MSN prepared nurse, how I use the art and science for my clinical decision making and judgment, and how being MSN prepared affects my judgment and decision making. Also, how does graduate level nursing impact my individual perspectives? First, the science of nursing is just that. It is the objective data, science, evidence-based practice, advanced physiology, principles, and clinical expertise that goes into providing safe, quality care. On the other hand, the art of nursing is more subjective. It's creative and involves the core principles of care, communication, compassion, and comprehension. This process requires mutual trust, respect, and open communication. The nurse should see the patient's worldview and advocate for the patient's best interests. Compassion reflects empathy and being free of prejudice. Patient-centered care is the balance between the art and science of nursing to provide the best possible care for our patients' values and needs. The patient ultimately has full control of all their decisions. It is critical for the nurse to acknowledge and respect any differing opinions and never to impose your beliefs or values on the patient, but to support the individual patient's values and beliefs and wishes to promote autonomy and empower the patient to make well-informed decisions about their care. This therapy communication develops rapport and trust and allows the patients to be and fully disclose critical information to make those judgments. Adequate patient-centered care also is involved in increased health promotion activities by the patient, increased treatment compliance, and ultimately improved outcomes. Next, I will define a couple key terms. Critical thinking, clinical reasoning, and clinical judgment sound like they could be the same thing, but they're a little bit different. Critical thinking is the ability to objectively gather, analyze, and evaluate data in any setting. We use evidence and science for our critical thinking skills. Clinical reasoning is using your critical thinking skills and applying them to a clinical setting to solve a specific patient issue. Clinical judgment is using your clinical reasoning to come up with an ultimate decision for your patient. Your clinical judgment is influenced by context of the situation, culture of yourself, the patient, or your nursing unit, and how deeply you do understand the patient's worldview and their values and beliefs and goals. The clinical situation that I'll share with you today is working in an emergency department. I took care of a 45-year-old male. Chief complaint was shoulder pain with abduction of his shoulder, tender tube palpation, and he has a history of moving some heavy boxes about 4 days ago. The triage nurse triaged him in ESI level 4 or non-urgent. It was determined that it was musculoskeletal by nature, possibly a nerve impingement, and he waited in the lobby 2 hours before being brought back to a room where I saw him. Using science and evidence, obtaining a full history including standardized tools for assessing pain, PQRST, provokes, palliates, severity, quality, radiates, and time, provoked by exertion or activities, palliated by rest. He described it as a squeezing or a pressure in quality. He says when he moves his shoulder, it will radiate up to his jaw and neck. And moderately severe, about a 5 out of 10, and about 3 to 4 days duration after moving boxes. We know that left shoulder pain can be an atypical symptom of a myocardial infarction or a heart attack, but being tender tube palpation and exacerbated by movement of the joint does tend to rule out any type of cardiac event. judgment and is more in favor of a musculoskeletal injury. He also has a reasonable explanation for a musculoskeletal injury at time of onset by moving the boxes. However, performing a focus assessment as part of the data collection for the clinical reasoning process. Through our interaction, I determined that he hadn't been to the doctor since he was a teenager. He has very low medical literacy. He is a smoker. He works a sedentary job, is pre-diabetic. And knowing these things about him, I can use the art of nursing to develop rapport and trust and to ensure that the patient does disclose pertinent information regarding his case. The patient does have quite a few risk factors for cardiovascular disease, although he is a young age. Upon inspection, I noticed that his skin was rather clammy and he had a bead of sweat rolling down his forehead. I differentiated whether this was anxiety or something else, and he did admit to me that he had been having episodes of sweating, dizziness, and shortness of breath when this pain comes along. These were all really big red flags for me using my past experience, and I used that reasoning to make the clinical judgment of obtaining an EKG on the patient to evaluate his cardiac rhythm, which did in fact show ST elevation in leads 2, 3, and AVF, indicating an inferior wall MI. I was able to bring this to one of the provider's attention and get him seen immediately. We initiated a code STEMI and began the process to transfer him to a hospital with a cardiac cath lab for PCI capabilities. We use science and evidence that the chest pain, and which is shoulder pain for him radiating to his neck, is a direct result of the myocardial ischemia from thrombus formation in a coronary artery. We use heparin to stabilize that thrombus, nitroglycerin to dilate the vessels, and increase perfusion to that heart, which will relieve the ischemia and therefore relieve the chest pain. Most recent literature does exclude using oxygen routinely, as oxygen was once thought to increase oxygenation of the tissue, is now proven to actually cause constriction of those vessels and can worsen ischemia. So we do not apply oxygen on a patient routinely unless hypoxic. Regarding the art of nursing, the previous experience makes me suspicious anytime anybody comes in with non-typical heart attack symptoms. Always take your suspicions seriously. Using the therapeutic communication, avoiding medical jargon, speaking in simple terms that he can understand, and respecting him, speaking to him non-judgmentally. Those are all things that I was able to do using the art of nursing to allow him to disclose further complaints with me and explore what else was going on, and not just simple shoulder pain. And I wouldn't have been able to get that information hadn't I developed trust and rapport with that patient. I knew he was very scared and anxious and has little knowledge of medical terminology and situations, using a calming presence, simple terms, explaining every step, the why, the what we were doing, and how they were going to help him. Risks and benefits were all very reassuring to him and his family. And then again, ultimately, he did need transfer to a cath lab because we can try to stop further damage at the heart, but evidence does show us that ultimately he does need PCI to open up that vessel with either a stent or coronary artery bypass graft to ultimately reperfuse and save that precious heart muscle. The clinical judgment skills taught during my MSN program really influenced my experience, background, and understanding of patient situation and context of patient care. I learned to utilize Tanner's model of clinical judgment intuitively in my practice, noticing that his skin quality wasn't right, noticing that he had other symptoms other than just shoulder pain, and interpreting all that data and his risk factors, and ultimately responding, making that decision to get further testing, EKG, lab work, getting a provider involved right away, not to delay his care, knowing that time is muscle and precious. And then we also reflect on our decisions. Reflection is evaluating how well our interventions work. We know from evidence that the pain he's experiencing is a result from the ischemia, and our treatment should reduce or resolve the ischemia, hence resolving the chest pain, so we can continuously reevaluate him, look for side effects of the medication and effectiveness of how our interventions are working. My graduate level training in nursing really increased my sense of patient-centered care and just reasoning and logic, intuition and creativity. Everything I do is truly driven for the patient's individual needs. I really became much more aware of my own biases and my own opinions, and I am now able to separate them from the actual facts and evidence, which enhances my clinical reasoning and decision-making skills, resulting in better patient outcomes and satisfaction. Graduate level nursing also made me incredibly more culturally responsive and sensitive to needs of other cultures, and to look at everybody's point of view. Not everybody wants cold water or wants eye contact or certain gestures. I can be more open-minded on other viewpoints, and maybe Western medicine isn't always the best answer. I can change my previous misconceptions and use presented evidence to change, and also be critical of evidence and things that I used to do. Just because we've always done it doesn't mean it's always right. And just continuing to grow and learn and improve our care that we give to patients. I've also started keeping a journal of my particularly emotional clinical experience and reflecting how I feel on those situations. Having those thoughts in writing can really help me understand how I react to a situation, how I can always continue to improve. Critical thinking is the foundation for clinical reasoning and decision making, builds a stronger foundation of knowledge, competence, and confidence in my abilities. Completing my master's degree in nursing enhanced my knowledge base and prepared me to be a leader and support a culture of lifelong learning, quality improvement, patient safety, and integrate evidence into practice to promote the best outcomes for our patients. In conclusion, obtaining my MSN degree increased my critical thinking, clinical reasoning, clinical judgment, and decision making. It has provided me opportunities to improve my level of situational awareness and develop the art of nursing, as well as respect for the science. And these things ultimately increase In conclusion, obtaining my master's degree of nursing increased my critical thinking, clinical reasoning, judgment, and decision-making abilities. These skills not only made me a more well-rounded nurse, but more culturally competent and sensitive to my patients' needs and able to individualize my care plans, which optimizes patient-centered care. It also made these processes very intuitive and natural for me instead of having to step back and think about it. There are countless reasons to pursue your MSN degree, including having an increased appreciation for the art of nursing and increased knowledge base and understanding of the science. I encourage my listeners today to explore their options for graduate nursing programs and fulfill the personal accomplishment and professional development goals. Are there any questions? All right, if there's no questions, feel free to email me or talk to me after the seminar, and I'll be glad to help and guide you, and good luck in your journey.